Hey, beautiful soul. You're listening to the Rising into Mindful Motherhood podcast, your weekly dose of fertility wisdom. I'm your host, Dr. Katie Wood. I'm a barefoot mama bear, pharmacist, and integrative fertility coach. This is your go-to podcast for all things to naturally nourish your fertility, embody womb healing, and reclaim your feminine power to accelerate your path to pregnancy. My expert guests and I will be having intentional conversations to discuss the many facets of a thriving, fertile foundation, natural wellness, and how we grow and transform as women on our journey to motherhood. So let's dive in, shall we? Hello and welcome to Rising into Mindful Motherhood. In this episode, I'll be talking with Dr. Katie Lee. She's a dentist, speaker, and coach. Her passion about oral systemic health comes from personal experience and is detailed in her book, Saved by the Mouth. Dr. Lee has won top 40 under 40 dentists in America and International Woman of the Year in Dentistry. So quite the accomplishments there. And in today's episode, we'll be discussing the role that oral health plays in a woman's overall health and fertility. So really something that we haven't spoken to on this podcast yet, and I'm excited to talk about it today. And something that I think isn't typically thought about, right? How our oral health can have an impact on our fertility. So welcome, Dr. Katie. Super happy to have you here.
Yeah, I'm excited to be here. And you're right. It's not something that a lot of people think go together. In fact, quite the opposite. Usually it's avoid the dentist when you're pregnant or trying to get pregnant because it can do some harm. So I'm here to dispel that myth.
Awesome. Yeah. So let's dive right in. How can oral health have an impact on fertility?
Yeah. Oh gosh, there's so many ways. I would say the main thing that we'll probably be talking about today is just oral health, microbiome dysbiosis, cavities, infection. They can play a major role in couples trying to conceive. And so, what's really important to note is it affects both men and women. It's not just a woman's issue or a woman's problem. So, it can really affect them, their ability to get pregnant. It can affect the ability to carry the baby to term, and it can really affect maternal health outcomes. So, those are the three main ways how oral health can really adversely impact fertility.
So I just want to highlight it can affect both partners because a lot of times fertility is really just put on the woman's shoulders. So just keeping that in mind that you want to make sure your partner is going to the dentist as well. And you mentioned it can affect the microbiome, which I'm familiar with, but some of the listeners may not be. So if you could dive into that a little bit more.
Sure. So we have several different microbiomes in our body. We have a microbiome on our skin, in our sinuses. We have an oral microbiome, the gut microbiome, which everyone I feel like is familiar with. We have the genital microbiome as well. And so basically, we have over 700 different species of bacteria in our mouth. And these are all types of species. So it's not just bad bacteria. When we think of bacteria, a lot of people are like, oh, that's bacteria, they're really, really bad. That's not the case. We have good and bad. And what we really want is a very diverse group of bacteria that's in the mouth. And then we also want good bacteria or oxygen loving bacteria to outweigh the bad negative pathogens that are gram negative anaerobic bacteria. So we kind of want this environment in our mouth, the microbiome is what we call it, to be in homeostasis, meaning balanced. So super diverse and more good bacteria than bad pathogens. When we have that, then our mouths will tend to be healthy. So we won't have things like gum inflammation or periodontal disease. We'll also see very limited or hopefully no decay when our microbiome is imbalanced. And then we'll also see things like healthy teeth. So we'll be able to avoid tooth abscesses or recurrent tooth infections as well.
Yeah, and I know that our oral microbiome is connected to our gut microbiome, right? Because
Yeah.
that's where we're eating. Our food is in our mouth. So it essentially starts there.
Yes, I love that you brought that up because like I said, everyone really talks about the gut microbiome and how important it is. And it is. It's responsible for our immune system. It's responsible for our mental health as well. But what people don't realize is how did the gut microbiome come to be? How did it get there? And it's because it starts in the mouth, like what you said. So the mouth is actually the beginning of our digestive system. So often, especially in medicine, we've taken the mouth out of the body and kind of made it its own entity or subs. It's not even a subspecialty of medicine. It's something completely different, right? It's not even considered part of medicine. But the mouth is actually the beginning of the digestive tract. And the mouth, the oral microbiome, is what is seeding the gut microbiome. So you cannot have a healthy gut microbiome if you don't have a healthy oral microbiome. So it's really important that we pay attention to the oral microbiome as well.
Absolutely. And this just like came in my mind while you were speaking about that. When we have a natural birth, we are seeding our children, and how is that entering their body? In their
Yeah.
nose, in their nasal cavity, and in their mouth. And then it's going to really seed and ideally optimize their gut health from there.
I love that you brought that up because we always talk about vaginal births being really important to the health of the newborn. And that's because the babies should be essentially sterile, right? When they're inside the womb, there's a little bit of bacteria that's present. We know that now. But if too much bacteria gets inside the womb, the baby can't tolerate that because there's no immune system there and the baby will actually pass away. So, one of the things that leads to, or the main cause of stillbirths, one of the main causes of premature labor and preterm birth, low birth weight babies is actually an infection by oral bacteria, Fusobacterium nucleatum. So FN freely gets to the female reproductive unit, and the metabolites of FN are toxic to the fetus and will cause stillbirth. So I've seen this in my practice of women that come in and they've had a stillbirth, and it's usually recurrent stillbirths. We'll test their microbiome and they have high levels of FN, which is really unfortunate. But as you say, when we have the baby vaginally, that's really important because that's the first seeding of the microbiome to the newborn child is through the vaginal canal. And so, yes, it does go into the orifices, and that's really important. So, as the mother, it's important that your microbiome is super healthy and robust and in balance because you're literally transferring your bacteria to your child. Because otherwise, without that, they're really exposed to the environment. And so that's why when we have newborns, we're really concerned about their immune system and their susceptibility to getting all sorts of colds and viruses and bacterial infections and all this stuff is because their immune system isn't robust yet. And so everything that is surrounding them in their environment is going to help build that microbiome. And part of that is going to be what's on your hands. Let's say your oral cavity or your oral health is not optimum. Every time you're kissing your child, you're transferring that bacteria in your mouth to your child's skin, to their mouth. If you're drinking after them or licking spoons, all of that is getting to the baby. And so a lot of times I'll have patients come into the practice and they'll say, I have bad gums, but bad gums run in my family. It's not genetic or genetically that it's running in your family. It's because we're transferring microbiome down between generations. So that's another reason why it's really important to keep your microbiome healthy because you're going to transfer that to your child.
Very good point. And I've never heard of that in terms of the stillbirth that you had mentioned. Do you do a swab in the mouth to test the microbiome?
Yeah, so it's really easy to do. It's a simple spit test, and you can take them from your own home now. You don't even have to go into a dental office. So you can swish and spit into a tube and send it in, and you can get a report back in about a week on what the microbiome looks like. So we'll look at good pathogens, we'll look at bad pathogens, and we'll figure out if any of the bacteria specific to fertility or whatever condition we're looking for are present. And what's really cool about this technology is not only can we no longer have to guess, right? A lot of times, at least in dentistry in the past, we've always guessed what was going on based off of what we could see by looking in the mouth and by what we could see on x-rays. But that's really a reactive approach to health because we have to see destruction first before we can diagnose it. Now with technology, we're getting more and more tech into the dental space, which is awesome because it's allowing us to catch things earlier on a microscopic level because we can actually do testing now. Just like your doctor can take a blood test and see what's going on, we can take similar tests, saliva tests, to see what's going on with the microbiome and hopefully catch disease earlier so that we can stop it in its tracks. So yeah, it's just a simple saliva test that we can do. And then when we get the results back, now we know what's going on and we can treat it very specifically and precisely and tailor the treatments to the patient versus just throwing the kitchen sink of tools and hoping that something works because bacteria are all different and they're all treated differently. And so we need to know what's actually present to render the appropriate treatment.
That's very cool and good to know because I would imagine that if someone has had a stillbirth or presenting with multiple, typical conventional medicine wouldn't know to explore that option.
No,
So,
no. And I'm sure you've had this experience too or heard of things like this. Unfortunately, I think with women's healthcare and reproductive health, I feel, and because I've been a fertility patient myself, I feel like women deserve better treatment than what we're getting, especially when it comes to reproductive health, especially when it comes to maternal health during pregnancy and after. And it's kind of like, it's not disregarded, but it's just like, oh, these things can happen. Let's move on. Let's try again. And it's no, wait, like we're put on this planet to reproduce. So let's not accept that, oh, these things can happen and let's figure out the reason why, because no one should have to go through that, especially, in year 2024. Let's figure out what the cause is so that it doesn't happen again, because it's pretty horrific when something like that happens, or even a miscarriage. I mean, it's devastating.
yeah, it's life changing. So I agree with you 100%. So I love that you shared that. Now, I feel like we've all grown up being told by our parents or our dentist to brush and floss our teeth twice a day, right? That's like the typical oral health advice that we get. But I would love to hear 3-ish tips, however many you may have, of how can we support optimal oral health? Using our 4-step restorative fertility framework, we will 1, reveal the physical and energetic root cause. 2, we will remove the barriers to you conceiving and carrying a pregnancy to term. Number 3, we will rebalance the physical and energetic body with bio-individual strategies. And number 4, receive. You will nourish the mind, body, and spirit so you can receive baby. I have 3 one-on-one spots, and this is for the woman who is ready to claim her fertility back. She's ready to step back into her power. She is ready to do what it takes to finally get pregnant. If you want to learn more about this, find me on Instagram at @the_wellness_pharmacist. My Instagram is going to be in the show notes.
Yeah. Great question. Oh my gosh, this could be like a 2-hour discussion in itself. I think the first thing that is really important to note is to get a saliva test and figure out what's going on in your mouth, because even if you have really good healthcare practices at home or oral health practices at home, you can get an oral infection or a microbiome dysbiosis just by the people you surround yourself with, by touching things and then putting things into your mouth. So just like you can catch a cold, which is viral, or you can catch a bacterial infection, strep throat, or something like that, you can disrupt the oral microbiome by your environment. So I think it's really important first is to know what's going on in your mouth. If there's an issue, you can get it treated. And then once you're restored to health, it's easy to maintain it yourself. But without a saliva test to start, I think it's pretty hard to regain health if you're not healthy currently. Once you've got your saliva test, you've gotten your treatment, you're healthy, the basics honestly will get you pretty far. So what I always say is make sure you're using an electric toothbrush. Use it for at least 2 minutes. If you can do a good 3-minute brushing right before bed, that's ideal. But definitely want to brush at least twice a day. So morning and night. I would like to take a second to explain the reasoning for that. A lot of people will say, oh, I'll brush my teeth in the morning. That way I'm super fresh and I don't have bad breath for other people. But then they skip the night brushing. And the night brushing is what's going to be most critical. And the reason is because throughout the day, we're eating, we're touching things, we're putting our hands in our mouth. And so we're building up all of this bacteria in the mouth. And over time, as soon as 5 minutes after brushing your teeth in the morning, we start to get plaque that builds up on our teeth. Plaque is literally bacteria and other proteins and such that stick to our teeth and they'll form a biofilm. So at first, we get a loose attached plaque that will form to our teeth. But over time, the longer that plaque sits there, the more integrated and cross linked and stronger it becomes, and the more pathogenic it becomes. So you've had this whole day of crap essentially building up on your teeth, and you're not going to brush it before you go to bed is like really gross if you think about it. We're also eating throughout the day, and the bad pathogens in our mouth love to feed on carbohydrates. So if you're really prone to cavities and you're trying to avoid cavities, you have to remove the food source to the bacteria and the pH source, which we could get into later, to avoid cavities. And then further, when we go to bed at night, our mouth dries out because we stop producing saliva. And so the drier our mouth gets, the stickier our teeth get, and the more easily the bacteria can stick to the teeth. So don't skip your nighttime brushing. That's a very long-winded explanation for have to do that. The other thing that's really important is that we have 5 surfaces on our teeth. And when you're brushing, you're only cleaning 3 out of the 5 surfaces. You're missing in between the teeth, the front and the back of the teeth. And that's just like really gross, right? I don't know how else to say that. But so if you're going to clean your teeth, make sure you're cleaning all 5 surfaces of the teeth, and that includes flossing. So yes, you must floss twice a day, non-negotiable. Another simple thing that people can do is a tongue scraper. Our tongue has all kinds of nasty things on it. It has bacteria, it has fungus, all the food and stuff that we eat. So you definitely want to scrape your tongue and clean your tongue at least once a day. Ideally, twice would be great, but at least once a day. And then using a gentle mouthwash. When we brush and floss, what we're really doing is we're disrupting and breaking down that plaque biofilm. And the rinse really doesn't do anything to aid in health. All it does is help rinse out any kind of excess bacteria. But a key thing here is to make sure that the products we're using are super gentle. So we don't want to use anything that has a poison label on it, anything that has SLS or any kind of preservative chemicals. That's going to be really bad for your microbiome and really bad for your gut. So try and use the more natural homeopathic toothpaste, floss, and mouthwashes, because that's going to be better for your microbiome as well. You don't want to kill 99.9% of the bacteria in your mouth, because good bacteria are easier to kill than bad pathogenic bacteria. So use stuff that's really gentle. And those are really, I'm sure everyone has heard that 1,000 times, but really, if you do that, I would say you're about 90% there.
Mm-hmm. So when you say like a gentle rinse, could that just be water?
It could just be
Or
water.
like,
Yeah. So there's like, for instance, I love using tooth and gum tonic. TheraBreath is also really good. Closis. There's tons of really great products out there that you can use that are really gentle. I'd stay away from things like Listerine, Crest Pro Health, which I'm probably going to get banned from saying these things, but I would stay away from stuff like that. Water is super great to rinse with. Just swish it around in your mouth, try and get everything broken out, and then spit it into the sink, and you're good to go.
yeah, I know a lot of those mouthwashes can have alcohol in them, which is what's going to kill that 99.9%,
Yes.
which we don't want that.
Yeah.
Yeah,
Yeah.
I
Because the
know.
good bacteria are much easier to kill than the bad. And so the first thing that's going to go when you're using an alcoholic mouthwash is everything that we want. And the only thing that's going to survive are the zombie apocalyptic pathogens, right? That can survive anything. And then those are going to be the ones to repopulate first in the mouth. So that's
Mhm.
really going to disrupt the microbiome. So try and definitely stay away from alcohol mouthwash. But alcoholic drinks do the same things. Huberman podcast talked about this, about how alcohol really disrupts your microbiome. And he was absolutely right. And I don't think a lot of people made that connection between, everyone's been saying, stay away from alcohol mouthwash, but no one has made the connection, or very few people have made the connection that drinking alcohol does the same thing, but worse, because you're constantly sipping it and drinking it. So if you can
Mhm.
stay away from both, that'd be great.
Yeah. So, two things have come to my mind. I'll have to separate them for sure. When you were talking about your mouth drying out overnight, so really we want to be breathing through our nose, not our mouth, because then that can increase the dryness in our mouth. So, do you have any thoughts on mouth taping? I know that that's a big trend these
Yeah.
days.
It's very in vogue. Yes, I absolutely love, love, love mouth taping. Yes, nasal breathing. It sounds like you're really familiar with the importance of nasal breathing.
Yeah, yeah, ideally, like your tongue should be touching the roof of your mouth and all
Yeah.
of that.
Yeah, so good for tongue posture is important. Tongue posture helps shape our palate. Our palate is the floor of our sinuses. So we want to have nice, wide, flat sinuses. Yeah, so nasal breathing is really important for a ton of things. Our nose is there for a reason, right? It wasn't just put on there for decoration because a lot of people don't even like the way their nose looks. But our nose is meant to filter air because our air is not completely clean. So we have, if you ever look at a CBCT or 3D image of our nasal cavity, we have these turbinates that go round and round and round in our nose. And there's trillions of cilia, which are tiny little hairs up in our nose. And the job is as the air comes in, it's warming the air. It's making nitric oxide, which is a really potent vasodilator for our blood vessels, which is important for blood pressure. And it also is filtering out all those pollutants so that anything that gets into our system is going to be a lot cleaner. Now, when we bypass our nose because of an obstruction, polyps, allergies, colds, whatever, we're breathing through our mouth. So all the dirty air, all the pollutants that are in our air are getting straight into our lungs. And that will cause a lot of systemic inflammation because we're putting, think about it, pollutants right into our body. Less oxygen is actually getting to our cells. We're not getting the nitric oxide. And so that's going to cause systemic inflammation. But we're also getting that dirty stuff into our mouths. Our tissues are becoming dry. When stuff gets dry, they get sticky. And then the bad pathogens in our mouth love to attach to sticky surfaces, and then they'll start to populate and cause a lot of issues. So, yes, nasal breathing is so important. I always tell people if they have issues with sinuses or whatever, make sure you get checked by an ENT because sometimes you do have to have some things fixed. But if everything is looking okay and you're just a typical mouth breather, it's probably because you haven't trained yourself to breathe through your nose. So I always recommend doing some mouth taping during the day first. And it takes a while, right? The first time you mouth tape, you might feel like you're choking and you can't breathe. But the more you force yourself to breathe through your nose, the more those sinus issues and all that inflammation is going to resolve over time. And so you can retrain yourself to be a nasal breather. Once you feel comfortable during the day, then do it at night. But it's so important for overall health, lowering overall inflammation, and for oral health.
Love it. Awesome. Thank you for that. So my next question was fluoride in toothpaste.
Yes.
So I know that that can affect our thyroid, among a few other things, which we're speaking to fertility on this podcast. So that could really wreak havoc on our hormones and just so many other things. So would just love your thoughts on that. And I know that there is an alternative that I use. I'm probably going to say it wrong. It's like hydroxy
Yeah.
Apet
Nanohydroxyapatite.
Appetit or something like
Yep.
that.
Yep.
But
Good
yeah,
job.
love to hear your take on that.
Yeah. And I'll admit, as a dentist, I've recommended and used fluoride in the past to patients. What I will say, there's a ton of misinformation out there about fluoride, and the dental schools are educating students that fluoride is when I went to school, which was a long time ago now, I hate to admit that, but when I was in school, it was the only way to prevent cavities and it was safe. And that's obviously not true. There's poison labels on toothpaste for a reason. And there's so many better alternatives out there now that don't have the potential side effects and the toxicity that fluoride does that I really don't think that it's a viable option anymore. And now we have so much more information about what it actually does and it's a neurotoxin and all this stuff. We really don't need it, to be honest. It's we can do better. And so nanohydroxyapatite is on the market, which is great. Calcium phosphate products are on the market, which is great. What I do want people to know though, is that if you're going to use a hydroxyapatite toothpaste, make sure it says nanohydroxyapatite, because the particles have to be small enough to actually integrate into the tooth. So sometimes there's products that say, oh, we have hydroxyapatite. If it's just hydroxyapatite, not nanohydroxyapatite, it's not going to do you any good. The other thing that's really great for oral health that is healthy and can prevent cavities and is really great at reducing sensitivity and actually will kill cavity causing bacteria is arginine. So if you look for products that have arginine in them, arginine is going to be great for, like I said, reducing cavities and treating sensitivity. A good product with arginine is just Tom's toothpaste. If you look on the label, make sure it has arginine in it. So that's really great too. But I always like to talk about, you can't just say, I'm a fluoride free person, I'm not going to use fluoride, but I'm also going to do all of these horrible things for my oral microbiome and end up with cavities all over my teeth. So I'd have some patients come into my office and they'd say, don't use fluoride on me, that's poison. But then I would look into their mouth and they had cavities on every single tooth. They had abscesses, they had gingivitis or gum disease. And I'm like, sure, we don't want to use fluoride because it's toxic, but like what you're doing to yourself is way worse than me putting a little bit of fluoride on your teeth. I think people need to be responsible and take some accountability for their oral health as well, and make sure they're not doing things to damage their oral health instead of just being on a soapbox of, I don't want fluoride. Does that make sense?
Yes, yes, it
There's
does.
better alternatives, but patients also need to take accountability for their oral health and not wreck their teeth.
Yeah, yeah, absolutely. So what would be some signs that if you are trying to conceive that would alert you to, okay, maybe I should see the dentist?
Yeah, that's a great question. I mentioned earlier that dentistry is safe and is welcomed all throughout the fertility journey. So before people get pregnant is the best time to go, because you can try and figure out if anything is going on with your mouth that would prevent you from getting pregnant, and your partner has to be your partner too. And if there's any issues that are present, get them fixed before you conceive. That's going to be the safest and best time. But a lot of people will get to me when they're already pregnant, which is totally fine. Let's go ahead and do a saliva test, figure out what's going on, figure out if you have any bacteria in your mouth that will harm the baby, or cavities or tooth abscesses, and let's fix those. Because when you're pregnant, anything that's going on in your body is getting to the baby. So just like, you shouldn't take medication while you're pregnant, you shouldn't have an infection either when you're pregnant, because that's all going and harming the baby. So we can treat you really at any time safely. We take precautions, of course, to make sure that we're being safe. But some things to look out for is anytime if you're brushing or flossing your teeth and you see any blood either on the string floss or in the sink or on your toothbrush, even if it's a little bit, that's a sign that there's bacteria in the gums, and that bacteria is getting into the bloodstream, hence why you're bleeding, and therefore going to the reproductive system. So you need to get that checked. If you're noticing any type of mouth odor, that's important to get checked, because that could be a sign that something's going on. Or if you've started to notice sensitive teeth or that you're grinding your teeth, I would definitely go to the dentist and get that checked, because that could be sensitivity, could be cavities, it could be vitamin deficiency, it could be gum recession, it could be tooth grinding. So we want to make sure that we're checking all of that for you. The best thing to do is before you conceive, go in, get these tests done to make sure you're good to go. And we want to test your partner because for a couple reasons. One is bacteria are communicable. I've already talked about how we're going to transfer bacteria to our kid. Anytime you and your partner are intimate, when it does take two to make a baby, you're swapping spit and you're transferring bacteria. So you don't want their bacteria. Let's say you're healthy, but your partner's not. He has a chance of infecting you. And then also, microbiome dysbiosis in a male partner, for example, can decrease sperm count, can decrease the sperm mobility, and can actually change the shape of the sperm to make it less likely to fertilize the egg. So very important that they get checked as well.
Really good things to keep an eye out for. And this conversation has inspired me to add oral health questions on my intake paperwork
Oh,
now.
wonderful. Thank you.
I'm
Yes.
like, oh my gosh, how have I not had that so
Well,
far?
it's eye-opening. I shared with you before we got on that I was a fertility patient. I was a fertility patient for 6 years. saw some of the best reproductive endocrinologists in the country, and not one asked about my oral health. And being a dentist, obviously, I checked my own before going through the process. And I took a 3D x-ray of my face just to make sure I didn't have any tooth abscesses. And I actually had an abscess on an old root canal that I had no symptoms whatsoever. And good thing I caught that before going through my treatment, because I was able to have that tooth removed and later replaced by an implant. But sometimes, to your question of what are some signs and symptoms to look out for, sometimes you don't have any. And that actually happened to me. So just important to get checked.
Yeah, amazing. So I know you have your book, Saved by the Mouth, and you're also offering for the listeners the first chapter for free. So tell us about the book and where they can find that chapter.
Sure. So, yeah, I wrote a book called Saved by the Mouth. It's all about how oral health affects systemic health. It's a really cheeky, easy read. It's not, I don't take myself too seriously in the book. Every chapter is dedicated to a different organ system. So we talk about heart health, we talk about brain health, gut health, cancer, arthritis, fertility, of course, and longevity. And then we also go over ways that you can improve your oral health and your overall health. And we create action plans and all sorts of stuff. We talk about diet, supplements, oral health care products. There's a lot of information in there. And I have the first chapter available on my website to download for free. So if people go to katieleedds.com, they can download the first chapter for free. Or if they are wanting to just get the book, they can buy the book off of Amazon.
Awesome. And I'll have the link in the show notes for both as well. And tell the listeners where they can find you, connect with you, and learn more.
Yeah, I do a lot of work with fertility patients right now. That's what I'm specializing in. And I do a ton of saliva tests for patients. And then I'll create a custom care plan to work with the patient and their dentist to get the treatment that they need to get their oral microbiome healthy. And so people can find me on my website, katieleedds.com. And that's Katie Lee, dentist surgeon.com, DDS.com. They can book an appointment with me there or reach out to me on Instagram, same handle, Katie Lee DDS. And then I'm building a new oral systemic health clinic that will be open in Denver, Colorado in February 2025, which I'm so excited about. So I can see patients there starting in February.
Exciting. Thank you for being here today. I learned a couple of new things, so thank you for that. I know that the listeners are going to get a ton out of this episode.
Good. I appreciate you being open to having oral health. I know it's not everyone's favorite topic, so thanks for having me on and being able to speak to your audience.
Thank you so much for tuning in to the Rising into Mindful Motherhood podcast. If this episode resonated with you or gave you an aha moment, stop what you're doing right now and write a review. This simple act of kindness helps me get this podcast out to connect with as many women as I possibly can. I also have a special offer. If you send me a screenshot of your review, I will take $250 off one of my premium coaching containers. Let me know what resonated with you the most and why. So connect with me in my free Facebook community or tag me on Instagram. You'll find both listed below. Thanks again from the bottom of my heart for tuning in to this episode, and I'll see you next time.